My name is Stacy Mitchum. I'm a family nurse practitioner student at Texas State University. And Mr. B and I are doing an instructional video on self-breast exams. I'll be teaching him how to do them as well as my audience. And we'll start with a history. So Mr. B, do you have any medical history that you know of?
None.
Have you had any surgeries?
No.
Okay. And how about any childhood illnesses?
No.
Okay. And are you allergic to anything?
Nope.
Okay. So if Mr. B was a female, I would be asking him his age of his monarch onset, pregnancies and how many were to term, lactation history, how many children were breastfed and for how long, any exposure to any chest radiation?
Nope.
Ever had a mammogram or breast imaging?
No.
Good, okay. Also, in premenopausal females, we want to ask about their last menstrual period and if they're taking any oral contraceptives or any devices that are putting estrogen into their system. And then with postmenopausal women, you want to ask about their date of menopause and if they're on any hormone therapy. Do you perform self-breast exams?
I don't.
Okay. So part of the family history, I found a tool from the United States Preventative Services Task Force. It's called the Pedigree Assessment. This is going to let me know if I need to send Mr. B for the BRCA1 or BRCA2 gene genetic testing. So I'll just ask a few questions. Does anyone in your family have a history of breast cancer, either over the age of 50, I'm sorry?
No.
Okay, and then under the age of 50?
No.
Okay. And any ovarian cancer or male breast cancer at any age?
No.
Okay. And then are you of Ashkenazi Jewish heritage?
No.
Okay. So he answered no to all those, so his score is a 0. But if it had been an 8 or above, then I would recommend him getting some genetic testing. So we're going to move on to the exam part, and I'll just set up for that real quick. Sir, would you mind just sitting on the edge of the exam table here? All right, would you mind removing your shirt? Now, Mr. B is a male, and of course he has less incidence of acquiring breast cancer than a female would, but it's really important to check our male patients as well. So we're going to start with an inspection. We're just looking at his chest, looking for symmetry, looking for any dimpling or anything bulging out, or and looking at the shape of his nipples and if they're inverted or and if they're the same. So I'm going to have him do a few maneuvers that may accentuate any dimpling. I'm going to have you pull your hands like this. Yeah, pull out. And I don't see any asymmetry or any dimpling or anything. And then I'll have you put your hands on your hips and push. Perfect. And same, looks good. So now we're going to go to the axillary node assessment. So I'm going to have you just relax your arm here, and I'm going to start at the bottom, feeling any nodes in the axillary area. And we're going to check the anterior section, and we're doing this with 3 different pressures, light, medium, and hard. We're just feeling for any nodules and being careful not to pull any hair. I'll go up a little bit higher. We're going to go all the way up in the middle to make sure we don't feel anything there. We're going to feel these nodes up in here. Good. And our brachial nodes here. We don't feel anything. And we would do the same thing on both sides. For the purposes of this video, we're just going to do one side. So I will have you lay down. Is the temperature okay in here for you?
Yes.
Good, good. All right. So when you have your client lay down, you want to have them lie flat, and you want to have them put their arm over their chest, or I'm sorry, over their head. And this will spread out the breast tissue. If I had a female patient that had a lot of breast tissue, I would put a pillow up underneath their shoulder blade to make the tissue spread out a little bit more. So you can do this multiple ways. You can do a circular motion. You can do up and down, back and forth, and a spoke where you start at the nipple and go out to all ways. But I'm going to choose the up and down method, and I'm going to start all the way at the tail end of the breast tissue, which is the upper outer quadrant of the breast. And I'm going to use the first 3 fingers of both my hands, and I'm going to do circular motions in 3 different pressures, light, medium, and down to the bottom of the breast tissue. I'm feeling for any lumps, nodules, moving, fixed, tenderness. Mr. B can tell me if he feels anything tender. Now, if Mr. B was doing this on his own, he would just use one hand, possibly while he's in the shower. Sometimes it helps to have some soap because it makes it a little bit smoother. With the male, they can just pick one day out of the month and do it at that same time every month, since they don't have the hormonal changes like women do. But women, you want to choose 5 to 7 days after your menses start is the best time to do it. I'm just going up and down with my 3 different levels of pressure. And going all the way to the edge of the pectoral muscle. Maybe a little bit harder in nails to determine where the end of the breast tissue is. So I've done every piece, and then I'm going to palpate the nipple. I'm just checking for any nodules or anything underneath there. And did you feel any tenderness or anything?
Nope.
Okay. And then for a male patient too, you want to check for any discharge. I don't remember if I asked Blake if he's had any discharge or lumps. Have you felt any of those kind of things?
No.
Okay. So we're just going to mound up the breast tissue and just kind of push and see if we see anything, and we don't. And mounding up also, you can look for any dimpling that you see. So that concludes my video. Thank you for listening. I hope Mr. B learned some things too.